Now, forensic toxicology is basically the branch of forensic medicine which is dealing with poisons. Now, the word poisons is basically indicating the intention with which a substance is given to an individual. Over here, I want to emphasize on the fact that basically almost anything can prove to be a poison. For an individual, depending upon the physical state of the individual, depending upon the age of the individual. And all of these things basically matter a lot when you are working as a medico-legal officer and you get these cases and you have a suspicion that it might be the case of poisoning that you're dealing with. Sometimes you have to deal and save the life of an individual, and on the other hand, you may be dealing with an investigation and you want to find out whether this death was caused due to some sort of a poisoning or not. Broadly, when we are suspecting these cases and whenever we are investigating these cases thoroughly, we have different scenarios that we have to focus on. The major classification of poisons basically consists of the poisons which are acting directly on the CVS, that is the circulatory system, including the vessels. And then we have the central nervous system, we have the GIT, and all of these major systems, even it can be the genitourinary system that it may act upon. So it's usually a mixed picture, but the major action which results in the cause of death in an individual is basically marking the name over here, and this is how we broadly classify different substances which are usually used whenever we are dealing with these cases of poisoning or toxicology. One thing you should remember that it's very important to get to know the medical legal importance, whatever the case is, because we have to focus on the fact whether it is a suicidal case, a homicidal case, or an accidental case of poisoning. So these are the three broader aspects when you look at any case, living or dead, and you want to investigate this scenario, what caused the death of an individual or what caused this poisoning to take place. You would be emphasizing on the medico-legal scenario or the medico-legal aspect of this particular case over here. Now, again, it's very important, as any other medical case, you have to take the history in detail. That is going to highlight the fact that how the poison has been taken. And that is going to even enforce the fact whether it is an accidental case or whether it can be a suicidal or it can be even a homicidal case in a lot of cases. When we are talking about cardiac poisons over here specifically, the major poison that we have to deal in with over here is digitalis. Now, as you all know, digoxin is basically the active principle of digitalis over here, and even it is digitaline that acts mainly on the cardiac muscle. Now, this digoxin is basically even, it is prescribed to a lot of patients, and it's basically a drug that is acting or that is helping the heart to pump more effectively over here. So it's usually a normal prescription which is given to any heart patient in any cases of heart failure. So usually it is an accidental aspect that is linked to the digoxin poisoning, and it's usually an accidental case in which the patient forgets to take the medicine in the right amount and in the right dose over here. But there is a very interesting fact over here. You have to particularly investigate the case. There can be homicidal aspects to it as well. So a proper investigation only can lead the case into a particular direction over here. And all of these aspects would be discussed over here in this particular lecture mainly. So whenever we are talking about the cardiac poisons, we must know that the major and the most notorious of these poisons is the aconite. So aconite, Nerium, odorium, which is also known as yellow oleander, all of these are different plants, and you have to even remember this fact that different parts of this plant are basically causing poisoning in the individuals. And sometimes it is an accidental case because even a lot of these plants are confused with the normal edible plants out there. For instance, aconite is sometimes confused with horseradish. So it's very sometimes confusing because the roots are quite similar. They're white in color, just like a horseradish. And the only difference is the turning pink of the aconite roots, which is not present in the horseradish. Even after some time has passed on, it is not going to turn pink and it is going to remain white. So this is one distinguishing factor, how you can differentiate between the aconite roots and between the horseradish roots on the other hand. So the edible plants are sometimes confused with the poisonous plants, and this is sometimes the cause of the accidental poisoning over here that you have to basically focus on. And you must be well versed with the normal physique of a plant as well over here, because that is going to give you an idea regarding what kind of a plant we are dealing with. And even sometimes the people who bring the patient to the emergency departments in cases of poisoning, they're going to give you a lot of information what kind of a plant he had eaten, and then you might get to know that what is the major cause of poisoning over here in this particular case. Then moving on, nicotine is one of the most famous drug of addiction over here. It causes even psychological dependence, and sometimes it can be the physical dependence as well on the other hand. So whatever the case is, it is a drug of addiction, and it sometimes causes suppression and elevation of the mood, and that is basically very evident over here. Again, it's going to act on the cardiac tissue, and that is why we place nicotine in the classification of cardiac poisons over here. Moving on, we have oleander. So oleander, it has its own local names as well, commonly known in the particular areas, and depending upon which area you live in, you even have to focus on this fact that you must be well versed with the common names of the poisons as well. For instance, oleander is known in typical languages. For the native languages, it is known differently. So whatever country you are practicing in, you have to focus on the fact what is the common name for that particular poison, because sometimes even the patient himself or sometimes the relatives or the friends would give you a particular history, and they might be just telling you the common name or telling you the local name of that particular poison over here. So knowing the common names is sometimes very helpful when you're dealing with these cases of poisoning or toxicology cases on one hand. Then we have quinine. Quinine is a very famous drug which is used for the treatment of malaria. And on the other hand, we have, it can also be used in a lot of tonics that are usually taken. It's a bittering agent. It has a quite distinct taste, which an individual can distinctly remember that this is the taste of quinine. So it's not a kind of an ideal homicidal drug or a homicidal poison out there, but it can be accidentally causing poisoning in an individual if somebody is taking a lot of tonics which is containing quinine. So that can be one of the causes of accidental poisoning by the cardiac poisons. So these are the most notorious of these groups. And then we have cyanide. So cyanide, when we talk about this, it's an ideal homicidal poison. Why is that? So one thing that is related to it is odorless and it is tasteless, and the fatal period is quite short, and that is basically leading and making it a particular ideal homicidal poison over here. So these are some of the cardiac poisons on the list. Of course, we have a lot of others. For instance, we have Cerebra theriata. It's one of the cardiac poisons. And we have digoxin, we have digitalis, and we have cinchonism. Then we have Nerium, odorum, and all of these are basically a very important part of this list. that may go on, because all of the poisons which are acting majorly on the cardiac tissue and affecting the functionality of this tissue are going to be listed down here in the group of cardiac poisons particularly. So whenever we are treating these patients of cardiac poisons, one should remember that the general measures that one should take are the symptomatic treatment, then we have the purgative treatment. A stomach wash is very essential over here, it's not contraindicated at all, and we have to perform a stomach wash at any cost in these cases. Again, the route of administration is very important, depending upon whether it is a skin related and irritating kind of a route, or it is orally taken. This is very important. So you have to even mention that over here in your investigation or in your documentation, that what was the particular kind of route that the particular poison was given to that patient. This is again very critical, and that is going to highlight the fact and the line of treatment that we're going to take in these particular patients. One of the most important, one of the most significant of all of these drugs that we listed just right now is aconite. So when we talk about aconite, it's usually a very attractively colored flower that is seen, and usually children can get an accidental kind of a poisoning related to this aconite. Again, as I've already mentioned, it is quite confused with the horseradish. The roots are quite similar. All the parts of the plant are poisonous. So it's again very important to focus on the fact, and specifically the roots of this plant, they resemble the horseradish, and they're the most poisonous part of the plant. So this is again very important to highlight over here, how you distinguish between a horseradish and an aconite root is again very important. When you keep the aconite root at a resting phase, it is going to turn light pinkish color. So if we repeat that with the horseradish, the roots would remain white in color, and that is going to indicate the fact that how you indicate whether it is a horseradish or whether they are the aconite roots that you're dealing with. Then moving on, we have one of the other factors that we have to consider over here, that this aconite poison, it is going to resist heat, it is going to resist putrefaction. Putrefaction, as we all know, is one of the late changes that occur after death in the body. So there's a list of drugs, there's a list of poisons that resist putrefaction, and one of these poisons is aconite. You have to make a list, and you have to remember this fact that the list of poisons which resist putrefaction includes corrosives, it includes barbiturates, cyanides, datura, metals, nicotine, and even aconite can be included in that list. And again, one of the major factor is that aconite is also going to resist heat. And you can easily detect aconite in the dead body, even if it was subjected to heat, or even if you found the body in a burnt form, you can even detect the aconite poisoning quite easily. So this is very important. These are one of the pick points during investigation that you can highlight very easily. Now, the active principle that is present in the aconite is the Aconitum napellus, and when we go on, we have this Aconitum ferox. It's one of the other varieties over here. So these are two varieties. They look similar. They have quite similar appearances, and both of them can be placed, and both of them basically contain the poison aconite in them. Now, the mechanism of action of aconite poisoning, it's basically going to act upon the ion balance disruption. It is going to disrupt that balance, which is going to result in the cardiac functionality to be disturbed. So what is going to happen? What are the clinical signs and symptoms? There is going to be a fatal arrhythmia, and the patient is also going to suffer from ventricular tachycardia over here. And these are the two major causes of death during aconite poisoning, or whenever the patient is being poisoned by this particular substance of aconite over here. So if you have these similar signs and symptoms being detected in a patient, and even the samples are going to go accordingly when you send the blood samples and they're going to confirm that the patient was poisoned with aconite, then you can basically rule out this factor over here. Now, symptoms can also be gastrointestinal in their nature. Whenever I say that this aconite or nicotine or digoxin is a part of the cardiac poison, it doesn't mean basically in any sense that it won't have any other symptoms. The patient is going to have the GI symptoms as well, the respiratory symptoms as well, even the CNS symptoms. But the major cause of death would be the cardiovascular systems over here. So nausea is one of the sign and symptom, one of the clinical feature over here. As you can see, vomiting is induced in these patients. The patient can even come up with the complaints of diarrhea, and then obviously the burning in the abdomen. So these are the list of the gastrointestinal symptoms that are seen in the aconite poisoning over here. Now, all of these symptoms collectively, due to the dehydration, due to the CNS that is also activated on one hand, the person is also going to complain of a burning sensation in the stomach, tingling, and also numbness is going to be observed. These can be a part and parcel of the dehydration and even of the avitaminosis that is caused as a part of vomiting or as a part of diarrhea on the other hand. So these are a group of symptoms that can give you a mixed picture over here. Then moving on, we have the symptoms which are particularly and specifically cardiovascular. They basically include hypotension. Due to shock, due to diarrhea, due to vomiting, the patient can go eventually into a shock, resulting in the lowering down of the heart rate, named as bradycardia. Then we can have the sinus tachycardia as a resultant or as a compensatory effect when the patient goes into a tachycardia that is known as the sinus tachycardia. It's basically an attempt of the body to recover or an attempt of the body to compensate the shock that it is dealing with. And then finally, the patient can also face ventricular arrhythmias, obviously. Again, the functionality is affecting. The ejection fraction is going to be also affected in these particular cases of aconite poisoning. Mainly, all of these steps or all of these cascade of events are basically leading to a multi-organ failure. So specifically affecting the cardiac tissue, and that is why an aconite poisoning is basically acting upon mainly the cardiovascular system of the body. Moving on, we have the retinal symptoms as well. The patient is going to have a symptom which is known as hippus. So hippus is basically when initially the patient has a contracted pupil and then later on it becomes dilated and then it can again go into a contraction. Eventually, the patient is going to have a dilated pupil and is going to be a fixed size of the pupil. So this is one of the signs that can be observed in these patients of aconite poisoning, and it's one of a very characteristic sign seen in aconite poisoning, sometimes used as a diagnostic factor just to reveal the kind of poison that has been given to these patients. So these patients are to be noted down specifically when you're clinically examining, you're giving out a general physical examination, you're running down your tests and you're noting down side by side and documenting whatever factors you're dealing with, and you note down this hippus formation. This is going to highlight and it is going to be quite helpful in recognizing the kind of poison that you're dealing with. Then the causes of death in aconite poisoning are again very important over here. Heart paralysis is one of the factor, and then we have the respiratory paralysis as well. So this is going to lead to death in these cases of aconite poisoning, particularly majorly, of course, the heart paralysis, but obviously a respiratory cessation is one of the factors as well, which is quite prominent and which is basically the cause of death over here. The fatal signs The signs which are basically indicating that the person is going to be facing death in this particular case are: the fatal dose is almost a root, which is taken for almost 1 milligram of root, and aconitine 2 to 5 milligrams. So the active principle in a root of almost a size of 1 milligram basically contains 2 to 5 milligrams of aconitine, which is the active principle that we have. So again, the fatal period is almost 2 to 6 hours, which is quite a short period. If the fatal dose is given, it can result in the death of the individual. So it's quite life-threatening. The treatment would consist of monitoring of blood pressure and cardiac rhythm, and particularly, obviously, sometimes it is going to require an artificial ventilator, which is going to maintain that cardiac rhythm in these patients. Then a gastric lavage is very important over here, and it should be done as soon as possible in these patients. Lukewarm water is given, and sometimes basically you're going to pull out all of the unabsorbed poison as much as you can in these cases. So this is a kind of a purgative treatment as well, which can be given and which can be suggested for these patients. Sometimes this gastric lavage is being done with iodine solution. So it can be one of the options. If you're not using a lukewarm water, sometimes to disinfect in a particular manner, it's very important to use sometimes an iodine solution, and that is giving a lot of a symptomatic treatment to the patient as well. Then we have the potassium iodide, and particularly we have tannic acid. It can be given as an antidote, and it basically acts as an absorbent. As we all know, we have a larger classification of the antidotes. Sometimes the antidotes act as antagonists, sometimes they act as absorbents, sometimes they act as purgatives. So over here, the potassium iodide and tannic acid is basically acting as absorbents. Over here, charcoal is sometimes given, and is sometimes, even if you don't know the kind of a drug, or even if you don't know the kind of the poison which is given, we use a universal antidote in those cases to encounter the poisoning cases and to manage the cases in a proper manner. So sometimes we use an antidote, which is atropine, and it can be used in these cases of aconite poisoning. Specifically, the dose is 0.5 to 1 milligrams in these cases of aconite poisoning. Now, the postmortem appearances are again very important over here. They are quite significant in cases of aconite poisoning. Specifically, obviously, it is going to be specific of the fact and signify the fact that the death was caused due to the fibrillation, due to the shock that took place inside the body. So these are the prominent factors over here that we're going to consider. Sometimes it is mimicking a picture of asphyxia. Cyanosis is quite prominent in the extremities, specifically in the upper limbs, specifically in the lower limbs. Even the particular faces, the congestion, the congestive faces and the congestive facies, which is quite peculiar in cases of asphyxia, is quite importantly even noted down in cases of aconite poisoning. This is due to the fact that the heart functionality is disturbed in these cases, and there is an improper circulation taking place specifically in the peripheries, and obviously resulting in a picture which is indicating that the death was of an asphyxial type in this particular case. Moving on, the stomach mucosa, even it proves to be congested, and an ecchymosis is one of the factors that is quite predominantly seen over here. Then we have the duodenal mucosa congestion, and even the ecchymosis is seen over there as well. And particularly ecchymosis can be seen anywhere. Postmortem lividity is very important over here. It is going to be a deep color, as seen in cases of asphyxia, and is quite predominantly even can be seen over here in the aconite poisoning. So these are the particular findings as you would see over here in cases of aconite poisoning. Obviously, we're going to send the samples, the spleen, kidney, the gastric lavage, the blood samples. They're going to be sent to the histopathologist for the further review, and he's going to highlight the fact what was the cause of death in this particular phase, in this particular case, and even sometimes it is quite easy to identify the poison, which particular kind or which particular group of poisons was used in this particular case. Then obviously the medicolegal importance is very important over here. We have the accidental poisons, we have the suicidal poisons particularly over here, and then we have the homicidal cases that are usually seen. The most important of aconite poisoning is the accidental causes. As it is sometimes confused with a lot of edible plants. It is brightly colored, and that is basically indicating the fact over here. Cattle poisoning is one of the important factors. It is quite importantly used in this cattle poisoning phenomena, and it is people are not even suspecting this fact that this cattle poisoning took place, and sometimes the animal goes symptomless, and the death is basically undetected to be of a certain suspicious or a criminal kind in these cases. So indicating these cases is very important. One of the other kinds is sui poisoning over here, which can be even withholded into this group of poisons, which is known as cattle poison, particularly over here. Then we have the arrow poisons, and finally we have the roots being used in the abortion cases. Now it's not a very common practice to use the roots in the abortion cases, and it's just a phenomena which is being done, and it's a criminal cases usually that we use the roots as a part of the aconite poisoning, particularly over here. So it's again very important to highlight these facts and to note down the kind and the medicolegal aspects that are associated with any kind of a poison, a particular investigation, clinical features, signs and symptoms noted down, the fatal period, fatal dose. And obviously, when you send the postmortem samples and you're just waiting for the reviews of the histopathologist, you can find out eventually that aconite was the cause of death in this particular case over here. So moving on, we have quinine as one of the cardiac poisons over here. So when we talk about quinine, it's one of the prescription drugs that is prescribed to a patient for the treatment of malaria. Of course, it's one of the very initial drug which was used in the treatment of malaria, even used now. And then we have a lot of tonics which contains nicotine. It's usually a bittering agent, and it's not an ideal homicidal or a suicidal drug, which is seen in these cases. So whatever the case is, when we go out and when we look at the active principle which is involved in these cases of quinine, what is the mechanism of action in these cases? It's again very important that sometimes this ingestion of quinine is associated with a phenomena which is known as cinchonism. So cinchonism is basically a group of symptoms and signs which you eventually see in these patients, and obviously when you investigate these cases, that is going to highlight the fact that there is a pathological condition caused by an overdose of quinine, or it can be even the cinchona bark. The bark of the plant can be even proving poisonous for the patients, which was used initially in the native regions for the treatment of fever not responding to drugs, and that is sometimes causing a chronic kind of a cinchonism in these patients. So this is the history which is related to the quinine poisoning. The mechanism of action underlying this kind of a poison is the strong protoplasmic poison that is usually seen. Then we have, it's also an anesthetic and sclerosing agent, and it usually blocks the sodium channels, which results in the cardiovascular toxicity, of course, which is topping the list over here. then it is going to result in the hypotension. Obviously, the patient is going to go into a shock kind of a state, and this toxic shock is basically resulting, and it has the symptoms of hypotension, particularly seen in these patients. Arrhythmias are very importantly seen in these patients, and then we have a cardiac arrest, which is commonly seen. Now, the sign and symptoms may also include, if it is a chronic case and it's not an acute case, the patient would not go directly into hypotension or in a shock-like phase. If it is a chronic case, the patient will slowly and gradually develop the sign and symptoms. For instance, the patient may complain of mild headaches and then ringing in the ears. This phenomena is known as tinnitus. Specifically, as I was mentioning, all of these group of symptoms, usually of a chronic type, are known as a part of a pathological condition which is known as cinchonism. So ringing in the ears or tinnitus is one of the phenomena seen, and then we have pupils which are dilated and fixed. We have mental confusion. The thought process is quite in a confused state. There's going to be a flight of thoughts, flight of speech is noted down in these patients. That is one of the significant factors over here. Moving on, we have other GI symptoms as well. So these are the general symptoms that the patient might complain of. And moving on, we have the other group of symptoms relating to the GI system. Particularly, the patient can complain of an abdominal pain, a discomfort noted down in the abdomen is one of the key features over here. We have vomiting and diarrhea. Then we have particularly the methemoglobinemia and the cyanosis of the peripheries, particularly the upper limbs, the upper extremities, the lower extremities are affected most importantly over here. Hemolysis and death due to uremia is noted down. The patient can eventually go into coma and convulsions, and ocular toxicity involving the retina, involving the cornea is also noted down in these individuals. So cinchonism, as I was already mentioning, all of these group of symptoms are sometimes collectively known as cinchonism, and that is going to require a proper treatment, either symptomatically, or you can even just investigate the case whether the patient is being poisoned or not. So again, it has its own medicolegal aspects that we have to even consider over here. Whatever the case is, whether it's accidental, it can be even accidental. There is a phenomena which is known as drug automatism. So sometimes a lot of psychiatric patients who have delusions, hallucinations, and delirium, they can sometimes have this kind of an accidental poisoning related to quinine over here. So it's one of the causes of death, and it is one of the medico-legal aspect that you have to incorporate in cases of quinine poisoning, specifically when we're dealing with one. The fatal dose over here is almost 8 to 15 milligrams, and then we have the fatal period that we have to consider. We have almost 6 hours to save the life of the patient if the fatal dose has been administered in the right way. So this is what we have to consider. Whenever we are studying toxicology, we have to keep one thing in mind, that we have to consider the fatal dose and the fatal periods as well. In these cases in a particular manner, because the treatment has to be given if you're treating a live patient. And again, you have to consider the medico-legal aspects over here as well and incorporate them as well in these cases. Quinine poisoning is again very important. You can even just see the different factors. You can carry on the radiological investigations, the lab investigations can be carried on, and they're going to highlight the fact the levels of absorptions are going to be highlighted over here in the cases of quinine. So it can be sometimes suspected, chronic kind of a poisoning is suspected, and you do carry out these radiological investigations, and sometimes they highlight a lot of factors over here. The medico-legal importance would contain the facts that it can be accidental in its incidence. The use of in high dose for abortion is sometimes given, and sometimes we have a phase of self-poisoning that is associated with it. So this is a kind of the medico-legal importance that you have to incorporate in these cases of quinine poisoning, and they're specifically important, and they are noted down, and you have to investigate the case. If you're suspicious that it was a self-poisoning case, how did it take place? Whether it is an accidental phase, how did it happen? You have to basically rely upon the facts and figures surrounding that particular case and note them down and document them down accordingly in a particular manner. So basically, when we classify the different poisons into different groups, one of the most notorious and listing in the cardiac kind of poisons is nicotine. Again, we can also relate, and we can also put this drug in the group of addiction as well. It's a highly addictive drug. It has its physiological dependence and as well as psychological dependence, and all of these have to be incorporated. So it's usually a chronic kind of a case, and it's affecting the cardiac muscle, and that is why it is enlisted most importantly in this group of cardiac poisons, particularly that we're discussing today. So one cigarette, it's almost containing 15 to 20 milligrams of nicotine. So again, 1 to 2 milligrams is absorbed by all mucous membranes. So we can even appreciate the facts over here that it's not usually a case of acute poisoning that is seen in these cases. It's usually a chronic poisoning that is taking place, a kind of a slow poisoning which is occurring. It has its own effects. It is affecting the cardiovascular system, particularly in these patients. Now, the mechanism of action that we have to consider, how does nicotine act? What are the particular symptoms that we have to consider? Where does nicotine come from? It's obviously a plant, and all the parts of the plant except this ripe seed contains nicotine, an alkaloid, and if it is taken in any form, if it is inhaled, if it comes in contact with the skin and the skin gets irritated, because we use a lot of nicotine patches. They're quite common, and sometimes even those nicotine patches, a lot of nicotine and a lot of alkaloid, it enters the bloodstream. And again, it is going to affect the cardiovascular system very effectively, whatever the route of administration is. So even it is again very important to highlight the fact what was the route of administration, and then accordingly you're going to deal in with these particular cases. Even ingestion is one of the very important routes of administration that we have to deal in when we have these cases of nicotine poisoning. It acts on the autonomic ganglion, particularly initially stimulating, but in later stages, it is going to depress and even block the nervous signals. So this is one of the mechanism of action. Another is the action on the somatic neuromuscular junctions and afferent fibers from the sensory receptors particularly. Then obviously it is going to suppress the appetite while increasing the basal energy expenditure, and is again going to lead to weight loss in the patients. The extent of weight loss is going to depend on a lot of factors out there. So we have to consider and incorporate those factors when we are investigating these cases of nicotine poisoning in particular. Now, we have the acute cases, as I was already mentioning, and then we have obviously the chronic cases that we have to deal with. While we have the acute poisoning, there's a burning sensation in the stomach, which is coupled up with abdominal pain, nausea and vomiting is seen. Hypersalivation, a lot of saliva is secreted or it is produced, muscle weakness, and then obviously we have diaphoresis or meiosis. It's one of the factors. Basically, there is a constriction of the pupil that is noted down. Then we have tachycardia and a lower down blood pressure. Coma and paralysis ensues at the end, and the overall result would be a death due to arrhythmia, or even it can be respiratory failure, which is resulting in death of that individual. Then we have the cases of chronic poisoning, and the sign and symptoms would include cough, wheezing, dyspnea, anorexia, which is basically the loss of appetite, and then we have vomiting, diarrhea. Anemia is quite notably seen in these patients. Tremors are noted down, and then we have the irregularity of the heart with extrasystoles, occasional attacks of pain suggesting angina, particularly in these patients. Now, nicotine has the fatal dose, which is almost 50 to 100 milligrams of nicotine, or 50 to 30 grams of crude tobacco if it is taken, or if it is ingested, or if it is inhaled. The fatal period would be almost 5 to 15 minutes after the fatal dose is administered in a particular manner. So a proper route of administration and a proper dose is very important to cause the death of the individual in a particular case. The postmortem appearances, specifically the lungs are affected in these cases, the heart is affected in these cases. There are going to be patchiness, ecchymosis, which is noted on the lung pleura, and even the pericardial tissue is involved, and it has the positive findings whenever we are suspecting a death which is caused due to nicotine poisoning. So, incorporating these kinds of positive signs in these cases is very important to consider in these cases. A very important drug, which is again cardiotoxic, is the Nerium. Commonly, it is known as oleander. It has its specific appearances. The symptoms would include nausea, vomiting. Ventricular tachycardia is noted down, atrial fibrillation, and finally it can result in an AV block, resulting in the heart failure of that particular individual. The plant would look similarly a whitish. We have a white variety and then we have a yellow variety, so it's depending upon what kind of a plant we have and what kind of a plant was ingested. The common oleander is basically, the postmortem appearances would consist of a mucosa, which is just resembling the death which is caused due to asphyxia. A congested GI mucosa is very important. And then we have the petechial hemorrhages on the heart, again, one of the important signs of asphyxial deaths. And so a resemblance and a confusion would be seen. So the differential diagnosis in these cases would include an oleander and obviously nicotine and all of the causative factors resulting in the asphyxiating deaths in the individuals. So over here, the discussion mainly relied on the cardiac poisons, the drugs affecting cardiotoxicity, resulting in the cardiotoxicity. How are you going to investigate these cases, and what are the peculiar postmortem appearances in these cases of cardiac poisons? So that is the end to this lecture. Thank you for watching sqadia.com.